Hello, hello, hello. Well, good evening and welcome back to our show tonight. I enjoy that when that comes on. This is Dr. Dwayne Wood. Tonight we are talking about men's health, and we're talking about why men should go to see their doctor. That's our topic for tonight. We're glad that you're here. Hopefully you had a great weekend, had a great day, and are ready to get your learning on and get some excitement. So we're glad that you're here. As I said, I'm Dr. Dwayne Wood. That's Wood with an E, and the E stands for endocrinology. We on this channel help to educate you, empower you, and to encourage you to take charge of your life and your health and go to that next level to get the life that you've always wanted, to coin a phrase from one of my favorite books, and to go to that next level, right? So that's what we're doing here tonight. So glad that you're here. If you are new to the channel, go ahead and put new in the comments, and because we'd love to welcome you. We would love to say hello to you. You'll see a little sample there. And also, if you have questions, go ahead and put those questions in the chat as well. And let me see if I can put that so you can see what that looks like. There you go. Put in front of the questions, and we'll grab those as we go throughout the evening tonight. So a couple of special things. First of all, you know that I always do our shout outs, and tonight I'm doing a shout out, first of all, to my son, right? So this is my incredible dad, right? That's what that says. Incredible dad. That's me. And I'm so proud and excited about the way that my son is growing. He's celebrating a birthday coming up here in a couple of days. So glad for that. And, you know, I lost my dad several years ago, and I'm so excited that I'm able to pour into this young man as I get ready to get him launched, right? So that's my goal, to get him launched well. Right. Sometimes, you know, but he's a good guy. He's a good guy. So we love him, and thank you so much for this. So Father's Day for all you dads who are out there. Happy Father's Day. That was yesterday, and hopefully you had a wonderful time. And if you have a dad that's still alive, hopefully you got a chance to reach out to them if you've not already done that. So go ahead and do that as well. It is I can't tell you the number of times that in years past, I said, you know, oh, my dad, he keeps talking to me, particularly when I was growing up as a kid, right? Oh, he keeps telling me stuff and over and over. And we have these conversations. He was kind of like a philosopher. And like, oh, my God, he's talking to me again. He's saying the same thing over and over. And sometimes I hear him now, right? I hear him now. Or I pass by the mirror and I see it, you know, I catch a glimpse of myself. And I was like, okay, I'm just like this dude, right? And and sometimes I wish he were around so I could bounce some stuff off of him. But I have other men around me who are fulfilling some of that right now. Okay. The other thing is that it is Juneteenth celebration today. Yesterday was Juneteenth, so the celebration commemorating the end of slavery. And so glad that we are in a space where we are able to talk about that and to celebrate it. So if you had a chance to do that, a lot of the federal institutions, organizations were closed today in celebration. So woohoo, right? So glad for that. And then finally, on the heels of Father's Day, actually I shouldn't say on the heels, because this entire month is Men's Health Month. And so as part of the Father's Day celebration, we thought, hey, let's do a show here dealing with men's health. So that's what we are dealing with tonight. So a lot of shout outs tonight, and just excited for that. Let's see. I think I saw Dr. O. Hey, Dr. O, how you doing, man? Glad that you are here with us. Let's give you a little hand clap. There you go. There you go. If you guys have not already been over to Dr. O's channel, you should get over there, the Minority Health Report with Dr. O. He had a good episode recently. So I think that came out, was it Tuesday or Wednesday? One of those days. Put that in the chat for me, Dr. O. But yeah, if you've not already done so, go ahead and get over there and take a listen. He's got some good stuff. Glad that you were with us tonight. So why don't we go ahead and let's jump on in. Let's jump into this topic. Now, this, and you guys saw, let me see, let me pull that graphic back up here. So you guys saw the graphic, you saw the advertisement, and you saw some of the words that were going along with it. So I'm going to do something that people say to me I should, all the people who do talks and shows, they said, don't do this, but I'm going to violate that and I'm going to do it tonight. Right? So the thought is in the community that women are the ones that should be going to see their doctor on a regular basis. That is imperative that they have these annual checkups. And particularly for men think that, oh, we shouldn't do that. Okay. Now, I'm going to tell you the end of the show right now. Okay. So why should you go? Right. That's the question. Why should men go to see their doctor? And the reason they should go to see their doctor is so they could live longer. One, they can be healthier. Two, they can have better sex lives, right? So in the bedroom, better libido, better drive. They can take their families to those trips that they want. They can build that house. They can, whatever your dream is, that's the reason you should go see the doctor. Because if you don't go to see the doctor, the chances of you getting to the dream decreases. That's it. That's the reason right there, right? Now, the reason that I'm telling you that here up front, right? The reason I'm telling you that here up front is because I want you to engage with me, right? So guys, this is for you, right? And women, if you have men in your lives, this is a place for them, right? This is a conversation for them. Because if you can give me just a few minutes, a little bit more than a few minutes, by the way. If you can give me just a little bit, right? And you can listen, right? You will see some of the things that I'm talking about, some things that you may have heard already. Some people may have been saying the same things to you. But those are the reasons why you should go see your doctor. Live longer, be healthier, follow your dreams, get those dreams that you want, avoid complications. Remember, that's one of our things, avoid complications, right? And be a better spouse, be a better father, be present because you are healthier in the long run. That's why you should go see your doctor, right? All right. So that's it. So you say, okay, all right, bye-bye, Dr. Wood. No. Don't go anywhere. Don't go anywhere. Stay right here. And by the way, if you have not already done so, right, go ahead and subscribe to us and, catch us on all of our social media platforms and send this out to your family and your friends, men in your life, your sons, your uncles, your cousins, your dads, women. If you're out there also, this is a good conversation for all of your folks. Okay. So let's go ahead and let's get on back. All right. So that's the reason that you need to see your doctor. Okay. Now, why do men not go see the doctor? And what does that do? What does that mean? You may have seen one of the ads that I sent out for this show. 40%, almost 41% of men are obese. Obese. As a matter of fact, Dr. O did a show, right? How do I know if I'm fat? I think is the title of it, right? So 41% of men are obese. 51, almost 52% have high blood pressure. Yeah. Almost 12%, 13% have no connection to the healthcare system. So they have no physician, they have no healthcare coverage. Yeah, that's huge, right? 42% are sedentary. That doesn't mean they don't work, but that means that they tend to be more, I'm going to use sedentary to define sedentary, right? They sit more, right? So they're not out, they're not active, right? They're active in maybe their job, but that's it. And then 1,769,884 men die every year in the United States. This is a huge number. So what's killing us? The number one thing that kills men is heart disease. Heart disease, heart disease, heart disease. You've heard it, right? And you've heard the numbers and so forth. But let's talk about some specifics about heart disease. Let me give you some numbers. Well, let's back up for a second. Let's go back and let's talk a little bit about why men don't go, right? So why you don't go, why you're not going. And if I'm honest, sometimes why I don't go, right? Yeah, here it comes. You ready? Number one, we think we got to cowboy up. We got to man up. We got to toughen up. Right? And so we tend to downplay symptoms. Our chest is hurting. Our arm is hurting. Oh, that's probably some indigestion. Right? I'm not feeling well. I've got a little pain. Oh, yeah, I think I twisted that, or I worked a little hard. I lifted a little bit too much. Right? I'm having trouble with my thought process. I'm having trouble with my mood. And oh, I'm just stressed. Right? We tend to downplay it because we've been taught that, oh, you got to get in there. You got to do it. You got to support. You got to be the man. And I'm telling you, I'm not knocking that because that's how I was raised. Right? Sometimes we see that little boy crying and say, hey, what are you crying for? Why are you crying? Man up. Right? Man up. So we tend to downplay things and we tend not to show up in the healthcare system because we're trying to be stoic, right? That's what we've been taught. That's what we're supposed to do. Isn't that interesting? The other reason that we sometimes don't show up in the healthcare system is that we're busy, right? I'm going to do it. I want to do it. But sometimes it's harder for men who are, the caretakers, the breadwinner in the home to take off. Right? Because you're out there hustling. You're out there taking care of your family, which is what the people in number one told you to do. You man up, right? And so sometimes logistically, right, timing wise, it just doesn't fit. It doesn't work. And then probably the third, there's some other reasons. We'll talk about one more of those later on. But one of the other reasons is that sometimes we've heard some stuff about those visits. And we're like, well, no, we don't want to be part of that. Right? We don't want to be in that. We don't want that to happen. We don't want that test. We don't want those tests to be done. And so we tend to stay away. So heart disease. The number one killer of men in the United States. Number one. It can happen in lots of different ways for lots of different reasons. Of course, some of the risk factors, diabetes, obesity, high cholesterol, high blood pressure, right? So all those things are risk factors. Smoking, risk factors for heart disease. Do you know the number? So let me back up. So one of the presenting symptoms of heart disease is sudden death. Did you hear what I said? Sudden death. As a matter of fact, 50% of the men who die from heart disease, that's how we knew they had heart disease. They died. So it wasn't that they had chest pain that worsened, that moved in their chest to their arm. They felt a little indigestion. Somebody took them to the doctor. The doctor did a test, did an exam, did an evaluation, found out that they had heart disease, and they just didn't catch it in time. Those are symptoms. That's a progression. These are people who presented with heart disease when they died. 50% of the people who die from heart disease, men, that's the presenting symptom. Men make up 50%, almost 50% of the workforce. That's people out there working. And we account for 92% of the deaths in the workforce. We make up almost 50%, but we account for 92% of the workforce in terms of death. So what are some symptoms of heart disease? And this actually gets us into another one of the things that happens, right? So heart disease. So erectile dysfunction, difficulty achieving an erection, or difficulty lasting through intercourse, right? So, and there are a whole host of other things that go along with that. Do you know that one of the presenting symptoms for heart disease is erectile dysfunction? Now, we talk about the vessels in the heart. We talk about the vessels in the brain when you have a stroke. We talk about the vessels in the leg because you can have venous and vascular problems, right? But you know where there's also a blood vessel? That's right. In the male genitalia. And if you have problems in your small vessels throughout the body, do you know what kind of vessels are in the penis? Small vessels. And so if I'm having problems in the heart, I can also be having problems with erectile dysfunction. So one of the reasons for going to see your doctor, and but here's a good place to talk about that other reason that I talked about that men don't go, because men tend to be less comfortable talking about sensitive things with their doctors. Now, women are more comfortable doing it. You know, they go, they get their exams, they talk about their doctor, they tell their doctor about all the things that are going on. But sometimes in my office, I've got to drag it out, pull it out of some of my patients. And when their wives show up with them to the visit, then for sure I know. And even when the wife comes with the patient, right, they're sitting in the room and we go through the whole discussion about whatever else they came for. And I'm almost done with my discussion. I'm done with the visit. And the guy hasn't said anything at all. And the wife says, "Hey, are you going to tell him?" Or "Hey, Dr. Wood, we have something we want to talk to you about." Right? Guys, that's how we are. We don't like to talk about certain things. And you know what? Because we don't talk about this, and let's step away from the death for a minute, right? Right? Because that's the ultimate. So think of all the challenges that we have in our relationship and in our lives, because there are these medical things going on that we're ignoring, right? Because you're having vascular problems, which can signify heart issues. You're having erectile dysfunction, and the erectile dysfunction is causing problems in the relationship. And the relationship having problems causes stress for everyone. And the stress causes us to have high cortisol, and us for not to be able to sleep, and for us to go and use this term called buffering, right? Where we're finding other things to do to deal with the stress. Food, for example, right? Watching too much TV, right? Social media, working all the time, right? See how that cascade happened? And that all comes because we didn't go to the doctor to get an evaluation. It's huge, huge. So erectile dysfunction, right? So heart disease, right? So heart disease can present with erectile dysfunction. So if you go to your doctor, the doctor evaluates you for heart disease. All right. They'll check labs. They'll check to look at your cholesterol and your A1C, and maybe do an EKG if you're having symptoms, right? They'll do an exam, and if you are fine, one of the things I learned years ago is check for lower extremity edema, right? And a lot of times people who have edema will have, and they're, overweight, they'll have sleep apnea, right? So go to the doctor, and let me say this to you guys, right? As a physician, I'm not hoping to find stuff. I mean, that's not what you're there for, right? When you come in, I'm not saying, okay, I'm gonna find this. I'm not looking for a list of things to find. But if you do have things that are there, right, that you may not know the significance of, then I can say, hey, this is, and here's the thing: if we catch it early, we can potentially do something, put something in place that corrects it. That's the beauty of all of this, right? That's the beauty of all of this. So finding things that we can then come back and say, hey, let's do this and this and this, right? So that's heart disease. Okay. Very good question, Dr. Z. I'm gonna hold on to that. Good one. Okay. All right. So heart disease. So let's lump erectile dysfunction with low testosterone, right? For a moment, right? We'll kind of talk around these two. So we've already said right now that erectile dysfunction, difficulty achieving an erection or lasting through the sexual act, intercourse, can be a sign of heart disease. Okay. Low testosterone can be a sign of poor sleep and obesity and heart disease, right? So and we've talked on this show about sleep before. So when you are sleeping, the pituitary gives off hormones. One of the hormones is LH. You get that surge if you're in deep sleep. When you get that surge, then your testosterone spikes. The LH is partially responsible for the erection that men have in the morning. So if you are not having good sleep, then testosterone can be low. You have decreased erections in the morning, and that can cause further issues, right? Your libido drops, the desire. So all of a sudden, also, here's another place where now that causes a problem in the relationship, right? Because he doesn't desire me. He doesn't want me. He's not interested in me. All coming from poor sleep, right? So obstructive sleep apnea. Now, let me say this. Let me pause. Let me put a pin here, and let me give a plug. So most people think that we treat sleep apnea because we want you to get a good night's sleep. And that partially is true. We want you to get good sleep because, as we've said, good sleep surrounds so many different things in your lives, right? So good sleep will help you lose weight, help you decrease your stress, better thought process, more focus, right? Less prone to accidents, lose weight, lower your blood sugar, lower your blood pressure, right? So all that stuff sleep will do. But one of the other reasons that we treat sleep apnea is because whenever you have sleep apnea, the body is forcing you to breathe because you're stopping breathing because there's collapse of your airway, and the pressure, right, that it uses to force the airway open, right? The pressure doesn't just go to the airway. The pressure also goes through the lung, by the way, to the heart. And now we have heart problems because of a sleep issue. So if you're out there and say, oh, my sleep is not that bad, maybe your sleep is not that bad, but we also are concerned about your heart. Right? So sleep apnea. I'm going to pause here and say, if you guys have not already done so, please go ahead and check us out on our social media platforms: LinkedIn, TikTok, Twitter, Instagram. Follow us there. And then, of course, here every Monday night, catch us live on our show We've got exclusive health and wellness talk here for you. And we have our coaching program, right? Dr. Dwayne Wood or Dwayne Wood MD coaching. We would love to partner with you to get you unstuck. And please send that out to your family and friends. Love to have you. Let's go back here for a minute, just so that you know. So we are here live every Monday. The next 2 Mondays, we will not be live, but we will have some special things that will air during our regular time for you. But we come on out and watch it. I'm not going to tell you what it is, but make sure that you are here. Awesome. All right. So low testosterone, erectile dysfunction. Now, one of the things that men sometimes are afraid of is the prostate. So let's talk a little bit about the prostate. So the prostate is a gland in the male anatomy. Okay? Women don't have this. And there are several things that can happen to the prostate. It can become enlarged. And when it becomes enlarged, it can cause urinary symptoms. So hesitancy, dribbling, decreased urine stream, right? Is another one. It can cause frequency, right? So getting up at night multiple times and going to the restroom. So not only does it disturb your sleep, right? Once again, back to the sleep issue, but it can be very inconvenient, right? And it can be painful sometimes, right? Depending on the urgency of the stream. And so we evaluate the prostate by looking at a couple of things, right? A prostate exam and your PSA, right? Prostate specific antigen, right? PSA. And so we check those, and with the combination of that data, then we make a decision about what we need to do. Okay. So let's back up for a minute. Let's talk about frequency, right? And urgency. Do you know that sometimes when you're getting up at night to go pee, that it may not be your prostate? It may be that the abdominal weight is pressing on your bladder and giving you the urge that you've got to pee. Right? So it doesn't have to be a prostate issue, right? It could be something else that's going on. And here's where I want to say that a lot of men have heard about the prostate exam and they don't go to the doctor because of the prostate exam. And there have been a lot of things going back and forth over the PSA and evaluating the prostate and what we should do. And what I want to say to you, if you're out there listening, if you have a man in your life, talk to your doctor, because it is possible to evaluate the prostate without doing an exam, right? That's where the PSA comes in, right? And the rules have changed over the years. This is a mutual conversation that we have between the doctor and the patient, right? So go in and talk to your doctor. Get their opinion. You have your opinion. You guys come to a decision on how to evaluate the prostate, particularly if you're having symptoms, right? Or a family history of prostate problems, right? So benign prostatic hypertrophy. So that's an enlargement of the prostate. And then, of course, there is prostate cancer, right? Prostate cancer. Now, prostate cancer tends to be less problematic in its symptoms than the BPH or enlarged prostate. Okay. So once again, make sure that you are discussing with your healthcare provider what are some things that we need to do, right, in terms of evaluating the prostate, because that's a big one, prostate. Colon cancer. Colon cancer is our next idea. Or next topic, colon cancer. And the recommendation currently is that colon cancer, you get screening at 45 or 10 years younger than the youngest person who developed colon cancer. Right? What does that mean? So that means that if so at least 40, if nobody in the family has colon cancer, then 45, I begin screening. Okay. But if someone in the family had colon cancer at 44, or let me back up. So let's say they had it at 45. Let's say they had it at 53. All right. So 10 years younger than 53 would be 43. So even though the recommendation is at 45 we start, now because I had someone who had it at 53, I'm going 10 years before that, and I start screening at 43 years old. Does that make sense? Hopefully I didn't confuse you with that definition. But 10 years younger than the person who had colon cancer, or at 45 years old. One of the diseases that I treat, right? Diabetes. And you've heard me talk about diabetes over and over and over. And I love talking about diabetes because the more information we have, the more we talk about it, I think the better treatment we will have and the better understanding people will have. So screening for diabetes, right? Anyone who has high blood pressure, anyone who's overweight, who has sleep apnea, high cholesterol, anyone who has a family history of heart disease or diabetes, right? So all those people, and I can go a list. I mean, the list is huge on the people that should be screened for diabetes. So make sure that you're talking, once again, and all that I'm describing, right? None of this is with the intention of scaring you, right? Which is why I did at first. Why do we need to see our doctor? To live longer, to be healthier, to do all the things that we anticipate doing in our lives, to be around to do those things. For you dads out there, right? Or granddads or uncles or cousins, whoever, teaching your young ones how to fish, how to boat, how to ski, all the things that you have done that you want to now pass on to the next generation. That's the reason that you go to the doctor. Think of all the men that passed, that died over the past year, who died because when we finally caught whatever it was that they had, it was too late. That's not where we want to be. Right? We want to get in there. We want to screen. We want to begin working on those things so that we can live longer. Right? That's our thing. Avoid complications and live a healthy, fulfilling life, going to the next level. Part of that is going to the doctor. Love it, love it, love it. Let's see who else is out there. I think I saw Dr. Charmaine. We said hi to you. Let's go ahead and bring that up. And we give you a little hand clap. Let's see. Dr. O from the Minority Health Report makes a good point here. He says the statistics is even worse in black men. All right. Statistics are even worse in black men. Thank you for that, Dr. O. And then let's pop this up. He says another episode will upload tomorrow. So he's talking about his Minority Health Report. So please check him out. Awesome. All right. So this is a good place for us to have our thought of the day. So today I want to talk about how do we grow? How do we grow? And to begin the conversation, let me read a quote, and I've got it here in front of me, from Bruce Lee. Bruce Lee, right? I love martial arts. Bruce Lee said, adapt what is useful, reject what is useless, and add what is specifically your own. So adapt what is useful, reject what is useless, and add what is specifically your own. And the whole idea here is there's so much that we come in contact with. There's so much data, so many people, videos, podcasts, shows, books, articles, emails, social media posts, right? So much that we come in contact with. And if we are not careful, right? We're like the bee, right? That is buzzing from one place to the other, one place to the other. And if we don't have a system to then take some of what we have gotten, what we've heard, what we've seen, and then incorporate those into our lives, then we don't learn, we don't grow, or it takes us a long time to learn and grow. So begin developing a way to adapt, to take the things that are beneficial from the different things that you're listening to and reading and right and attending. Adapt what is useful, right? Because not everything that you see in every post, every show, every word is going to be applicable to you. So adapt what is useful. Reject what is useless. Sometimes we think, okay, we've got to do exactly what we saw. And in some cases, it may be that in order to achieve that particular goal that the person is showing you, you've got to do it that way. But in a lot of cases, we can take some of what we saw, what is useful, reject some of what doesn't apply to us. Beautiful, right? So now we've got this piece of data. We've got this process. We've got this book, this quote, this song, these words, this motivation that we've adapted for ourselves. And then don't just let it stop there, because in order for it to be a part of you, in order for you to grow, in order for you to expand, in order for you to reach higher levels, you have got to add what is specifically your own. What is unique to you? How can you tweak that thing? How can you modify that thing? How can you get that thing to work for you? Even sometimes better than the person who taught it to you. So adapt what is useful, reject what is useless, and add what is specifically your own, from Bruce Lee. That is amazing. And if you do that, if you continually do that, then you begin to grow, you begin to expand, your mind begins to soar, your imagination gets better. And now you get to live that life that you've always wanted. That's our thought for today. Awesome. Bruce Lee. All right. So what are some screening things that we do? So we started talking about screening, right? So colon cancer screening, we said 45 or 10 years younger than the youngest person, or the person who, 10 years lower than when the person had colon cancer. Diabetes, we've talked about. High blood pressure, right? So high blood pressure is an interesting one. And it's interesting because over the years, we've changed how we look at blood pressure and what are some of the criteria. Talk to your doctor, because there are specific blood pressure levels, right? So we want your blood pressure to be 120 over 80. I usually tell people that I want the total number to be 200, right? So 120 on top, 80 at the bottom, right? That's what we want. And there are some special cases, right? So we won't get into all the nuances, but blood pressure is another one of those that can cause a lot of issues. And blood pressure usually, unless blood pressure has gotten significantly problematic, most people don't feel it, but it is causing damage, right? One of those silent killers, right? It is causing damage. If you have smoked, right? then there are two things that we want to make sure that we're screening for. Number one, we want to make sure that we're screening for lung cancer. If you smoked 30 years or more, then we want to screen for lung cancer. And if you smoke, we want to screen for something called an abdominal aortic aneurysm. That's just a ballooning of the aorta, right? That happens as a result for some people who smoked. And so they're just screening. And once again, all of this is screening, right? So we're looking to make sure there's not a problem. And if there is a problem, then we can do something about it early. Abdominal aortic aneurysm. Sleep. I'll tell you that as part of our practice, as part of what I do, I'm trying to think if there's a person that comes through the office, regardless of what they come for, that I don't ask them about sleep. How are you sleeping? Are you getting restful sleep? And then are you able, right? Are you able to do most things through the day that you want to do? Right? And people will think, they say, man, I really don't sleep. And then we get to why are you not sleeping? Right? What's causing the sleep problem? Is it a problem going to sleep? Is it a problem staying asleep? Right? And then we can begin pinpointing some of those, so screening. And then erectile dysfunction. I'm coming back to that one because we start asking people about that. Right? So in the office, as part of our review of systems, of things that are going on in your life. All right? Sexual desire and erectile dysfunction. Because they can be precursors to other things that are going on. Right? All right. Well, let's see. Let us, before I give you my last thought on this, let's see what we got here. Dr. C had a question. She says, how can men become more comfortable talking about these sensitive issues? How can men become more comfortable talking about the sensitive issues? And that is an amazing question. It's a wonderful question, Dr. Charmaine. I think part of what has to happen is that we've got to continue having these conversations so that we begin normalizing the discussion. When Bob Dole back in the, is it the 80s now? 80s or early 90s, got on TV and talked about erectile dysfunction, right? The gates opened up because it was a prominent person that was now saying to the general public that he had this problem. Think about all the medical, social problems that we have that we're comfortable talking about. Why are we comfortable talking about it? Because it's been normalized. And so having a conversation, this show, sending it to your family and friends, talking to your doctor, and let me say this for our fairer halves, for our wives and our mothers and our sisters and our aunties and all of those. We have egos. I'm gonna say it. Yes, we've got this thing, right? And so it depends on how we have the conversation. If you are a spouse and your husband is having trouble, saying to him, well, this is not going to work, it's probably not the way to start the conversation. Right? Because then, and think about it, right? So not only are we now having some confrontation about the issue, but now every time we begin to entertain the thought of being intimate, the anxiety goes up, right? And anxiety is not good for sexual function. In fact, in medical school, we learned, right? So the sympathetic, which is what the anxiety is responsible for ejaculation. So a man is having intercourse, he gets anxious because he's thinking now about all what's going on. Is it going to work? Is it going to last? Is she enjoying this? And then all of a sudden, right? We either ejaculate, we get premature ejaculation, or we decrease the erection, right? So having the conversation, and then planning, right? I think planning some time to discuss when it's not in the moment, right? So get away from the situation and then have the conversation. And maybe this is a time when, we go to the doctor together to discuss and have a conversation. And then for physicians, if you guys are out there listening, guys and gals, in the office, we've got to be more proactive with our patients, right? The number of diabetics that have erectile dysfunction is huge. The number of men who have high blood pressure, high cholesterol, heart disease that have erectile dysfunction, huge. And I know sometimes we get busy in our because there's so much that we've got to do, we've got to cover, right? And if that's not top of mind, right? We're trying to stop this guy from having a heart attack. We're trying to stop him from having a stroke. And so erectile function may not be top of mind in that visit. But maybe that's a time when we bring that patient back to discuss specifically that, hey, we're going to talk about your high blood pressure and your cholesterol today. We're going to devise a plan to treat, and we're going to bring you back specifically where we can have a conversation about erectile dysfunction or low testosterone for that matter, right? Or any of those sensitive areas that people may find themselves in. So hopefully that answered the question, Dr. Charmaine. That was a long way, around, but awesome. All right. So all of the things that we discussed, can probably be improved, other than the cancer, right? Can be improved before you get to your doctor. Yep. All of it, every single last one of it can be improved with 3 things: food, exercise, and sleep. FES, if I came up with an acronym. Food, exercise, and sleep. Okay, so let's run through together quickly. So food, we've talked ad nauseum about food. And if you Google food, you will see all kinds of things about nutrition and so forth. Okay. So one of the big things that we've got to do is we've got to change our relationship with food. If you didn't listen to my show last week, go back and listen to that. It was entitled Our Love-Hate Relationship with Food. So eating a balanced meal. Notice I didn't say deprived meal, but a balanced meal with good portion control. A balanced meal with good portion control helps with heart disease, diabetes, high blood pressure, right? Some say with prostate health. So eating a balanced diet. Exercise. Exercise helps to decrease weight. It helps increase blood flow. It helps decrease edema. It helps to improve your sense of well-being. All of those things can lead to decreased coronary artery disease, which leads to decreased erectile dysfunction if that's the cause. Right? See what's happening? Right? It's a cascade now. So exercise. We say 30 minutes a day, 7 days a week. 30 minutes a day, 7 days a week of brisk exercising. So that means that if you're walking down the street or if you're jogging and you're able to have a conversation, then you're not exercising enough. I said it. Right? So exercising. So watching our food, F, exercising, and then sleep. And I cannot tell you the number of things that getting good sleep will do. Guys, and I mentioned what, 6 of them already here? Huge benefit. So if we're exercising, if we are watching our food, and if we are getting good sleep, at least 7 hours of quality, restful, restorative sleep, then we begin decreasing the things that we just went through. And guys, so we get to live longer. We get to be healthier. We get to be around for our grandsons and our granddaughters and our sons, and walk them down the aisle and build a house and go on the vacation, and all the stuff that you've been working for all of your life, right? Because you've been going to work. You get to enjoy that because you're around. You get to enjoy it because you're around. Do you know that women, on average, live 5 years longer than men? Yeah, 5 years longer, right? So I want to be around to use some of my stuff. I'm laughing because I went on a guys trip. When was that? Probably about 6 months ago, maybe. And we had this conversation. Maybe one of those guys is watching, but I'm just kind of laughing through this stuff. All right. So food, exercise, and sleep. Huge. If we can do those things. Oh, and one more. Let me add another one. FES, another S. Stop smoking. Because if you go through and you look at all the literature, all the studies have been done, smoking adds extra burden to all the things we just described. And so that's what I want you to do. I want you to get out there. I want you to get to your physician. That's my call to action tonight. If you're watching this live on the replay, if somebody sent this to you, if you just happened upon it, then I want you to get connected with your physician, right? Start developing a regular time where you get to see your doctor, right? And begin talking about some of those areas that you may not be, that may be a little sensitive. Like you don't want to talk about them right now, but you, after listening to this, after hearing this, you realize how important it is for your family and for your life and for your future, and get connected to a physician. If you would like to work with us, we are excited that we have Dwayne Wood, MD coaching. And sometimes we get stuck. Sometimes there are these things that are going on in our minds. There are these barriers. And I would love to work with you to begin breaking down some of those. As I said, we are here usually Monday nights, every Monday night at 7. The next 2 Monday nights, we will have a special treat for you. So we won't be live, but come on out anyway and go ahead and spend some time with us. Guys, and gals, I am so excited that you are here. Dr. C says, yes, love it. Normalize the conversation. So much, if we normalize, will help. But love that you guys are here, you guys and you gals. Let's see. She said, men, don't wait until you are sick to see your doctor. Yes, please. Because we tend to do that, right? We minimize until it's gone far, where we don't want to do that and get sick before we go see them. Glad that you're here. So excited that we are learning together, that we are building this community, right? We want to educate, we want to empower, and we want to encourage you to take charge of your health and your life. Avoid complications, live the life that you've always wanted, and go to the next level. Thank you for being here. We will see you live in a couple of weeks, but see you here for the show that will air next week and the week after. let's get some music. Let's get on out of here. Thank you much. Good night.